Federal health officials have released guidelines establishing a pecking order for who should get the swine flu vaccine first when it's ready this fall. As NJN News health and medical correspondent Sarah Lee Kessler reports, the CDC says there are 5 groups that are top priorities.
When swine flu vaccine rolls off the assembly line this October, initially there won't be enough to go around. Who should get it first? Federal health officials, led by the CDC, have identified 5 high-priority groups: pregnant women, people in contact with babies 6 months or younger, healthcare workers and first responders, children ages 6 months to 18 years, as well as 19 to 24-year-olds, and adults 64 and under with underlying medical conditions such as asthma, diabetes, and heart disease.
It was important to address demand in the first 5 target groups initially and make sure we really reach them.
Pregnant women are of particular concern. To date, they've accounted for 15 of the nation's 302 swine flu deaths.
Pregnant women have a deficiency in that protective mechanism. So in fact, they get much worse influenza than non-pregnant women.
Children will receive top priority because they spread airborne diseases like flu very efficiently. But mothers I spoke to today were divided on whether to get their kids vaccinated.
It's so new, the vaccine, that I would want to know more about its side effects. I think it's very important for, as a mother, to take every precaution possible to protect your kids against this disease that's happening.
This Trenton doctor agrees with that, not just because she's an infectious disease specialist, but because she's had firsthand experience with swine flu tragedy.
Right now in my daughter's school, before the school closed, they had a 13-year-old child who died, a young boy who died, and whose death was attributed to the swine flu.
There have been 15 deaths in New Jersey out of 960 confirmed H1N1 cases. Heather Howard, New Jersey's health commissioner, says she supports the federal vaccine guidelines.
This targeting is really important because it's going to help us make sure that we're reaching out to the populations most affected.
The 5 priority groups account for 159 million Americans. As for the swine flu vaccine, the first 120 million doses are expected to be ready in mid-October. Sarah Lee Kessler, NJN News, Trenton.